Hello viewers, on today's episode on the Guided Midwife channel, I'll be talking about preconception care. So when we say preconception care, it's the care we give to women before the onset of pregnancy or before a woman can get pregnant. Although some women get pregnant without them even noticing they are, but that's not the case. The best thing to do is to seek for a care before you get pregnant. That's why we call it preconception. Conception means pregnancy, so pre means before, so before pregnancy. So where can we get this care from? You can get it from the ANC, from your gynecologist, from the media. Media from professionals, like what I'm doing right now. So from the media, you can get it from the television, radios, publications, and magazines. So what at all is the importance or benefit of this preconception care? It helps the midwife to identify risks, risk identification, to give education, to intervene if there is any identified risks, and to implement care. So when we take it one by one, that's the first one is going to be the risk identification. With the risk identification, we have something called the risk assessment. So with the assessment, we are going to take comprehensive history from the woman who wants to get pregnant. So we are encouraging women that if you come to the facility and you are being asked questions, please be frank with us. Tell us every truth that we want to, or everything that we want to know. Please don't hide anything. So because we are professionals, we are not going to tell anyone. We're going to keep your information confidential. So with the history taking, as I said earlier, you will take your family history, your medical history, your surgical history, your social history, family planning history. So with the medical history, you will ask the woman, do you have any medical condition? Maybe I have diabetes. The woman will be like, I have diabetes, I have hypertension, I have a heart disease, I have HIV, I have epilepsy, I have asthma, I'm allergic to this food or drug, I'm on medications. These are the things that we will be asking you, and we want you to tell us everything. Because if you have HIV, that you're having HIV doesn't mean you can't get pregnant. No, you can get pregnant, have a safe delivery without your child getting infected. So if you don't tell us, you are just putting yourself and your baby at risk. That's why we ask all these questions. If you are hypertensive, you have to let us know that you are hypertensive, so that within the course of your ANC visits, if we notice any rise in your BP, we will intervene fast. So with the family history too, maybe you as a mother, you don't have diabetes or hypertension or any other medical history, but your family does. Maybe your mother has diabetes or hypertension. We would want to know, because it's all about family. You can get it during pregnancy. The fact that you are not having those conditions doesn't mean you can't get it. You can get them during pregnancy. Because someone might be like, oh, I don't have hypertension, but I had it when I was pregnant. I don't have diabetes, but I had it when I was pregnant. They are all things that goes on during pregnancy. So you just have to let us know. Surgical history too. We do take surgical history. Maybe you've undergone an operation before that we don't know. Maybe it might be an operation that in a way really affected your womb or your ovaries and all those kind of stuff. So we want to know to help or intervene faster. About your social history, maybe as a woman, maybe you take in alcohol, you smoke. These are things we would want to know, because if you get pregnant, we would advise or encourage you not to do that, because it's going to harm the baby. Your family planning history as well, we would want to know the kind of family planning method that you did, either the injection, the implants, the oral pills, and all those kind of stuffs. We would want to know everything about that. We do physical examination too as well. What really goes on into the physical examination? We do head to toe examination of the woman who wants to get pregnant, because your height and weight really affects pregnancy. If you are too fat, you have something called the BMI, the body mass index. If you are overweight, it at times becomes very difficult for one to get pregnant. And with the physical examination too, we will check your vital signs, we will check your weight, your height, and do everything. So as I said earlier, with the risk assessment, we take your history and do some physical examination as well. We do some health screening, that's we can do pap smear, that's to identify whether you have cervical cancer. We check your HB, we check your HIV status, we check your blood group, and do so many lab tests for you. It helps the midwife to identify risks. If you are at risk of something, with all those things that I said earlier, it will help the midwife to identify risks. So as I said earlier, we have the risk identification, education, the intervention, and the implementation. So we are moving on to health education. That's when we'll be educating the woman to eat well, to take in adequate nutritious diet. I mean balanced diet. You should be taking like 6 to 8 cups of water a day. You educate the woman not to take in too much junk foods, or like you shouldn't be taking junk foods. Some women smoke and others to take in alcohol. So we would educate you on the need to stop taking alcohol and the need to stop smoking. I remember I said earlier on that men are included as well. As a man, if you smoke, it changes the morphology of your sperm. If I say morphology, the shape of your sperm. So if the shape of your sperm or the morphology of your sperm changes due to the smoking, you as a man, after you are married to a very nice lady, then pregnancy becomes an issue for you. Your wife getting pregnant becomes an issue. You'll be running tests, running labs, doing sperm counts, moving from one hospital to the other, and it will all prove futile. So we educate or encourage men and women to stop smoking. Occupation too also counts. Some women and men are radiotherapists, like they work at the hospital, they take x-rays for patients. You know, the x-rays, they are very, very harmful to the body. So if you want to get pregnant, we educate you based on your work. Yeah. We also do genetic counseling. Have you heard about Down syndrome? There are some genetic conditions that do occur. At times when a woman gets pregnant, we wouldn't be able to notice that the baby in the uterus has some genetic conditions unless the baby comes out. So we do genetic counseling, we run labs for the man and woman in order to identify any risk factor. Then we educate based on the results that they get. Yeah. And if infertility is an issue, maybe the infertility management, that's when due to some issues or problems the woman can't get pregnant. Maybe the uterus or the womb of the woman has been taken away due to fibroids and all those kind of stuff. So we take the ovaries from the woman, then the sperm from the man, then we fertilize it and implant it in a different woman for the other woman to carry the pregnancy for the woman whose womb has been taken off. That's what we call the surrogacy. We have the IVF, in vitro fertilization, and the artificial insemination. So I nearly forgot about breast examination. It's part of the physical examination. That's the head to toe examination. So we as midwives or professionals, we examine your breast. So if we identify any lump in your breast, we seek for urgent care or intervene or implement care for you. We also teach you as a woman self-breast examination, so that when you are at home, you examine your breast. So if you also identify any lump in your breast, you seek for urgent health care. Easy to come to the clinic, and if we ask you questions, don't get mad at us. We just want the best for you. Every information that you are going to tell us is going to be confidential. There is no third party who is going to hear about it, so that you are going to have a safe, pregnancy and delivery. Thank you.